How's it going, everybody? This is Dr. Chris Riedel with the Wellness Academy audio series, where our first guest is going to be Dr. Byron Jasper. Dr. Jasper is an absolute legend. He is a family care practitioner specializing in direct primary care. He's the visionary founder of the first Black-owned direct primary care clinic in Louisiana called the Byja Clinic. He also has numerous nonprofits and most recently turned into an author. So how you doing today, Dr. Jasper?
Doing great, man. Thank you for having me. Amazing intro. That guy sounds pretty fancy, but I think you just doctored it up. I'm just a regular guy who's just doing stuff and figuring it out as we go along. But thank you for having me, and awesome what you're trying to do here. I'm looking forward to today's conversation.
Yeah, absolutely. But how's today find you? You having a good day so far?
Yeah, man. No complaints. Work is working, as I say, but I joke around with friends of mine who I talk to, depending on what's going on. And I tell them there was a point when we were starting that we wished we were this busy. And now that we're this busy, we shouldn't complain that we're this busy. So it's like the stuff you're wishing for when you finally get it, don't sit there and complain about it. But it's going to happen. So it's a blessing to have the phone ringing to where we are able to provide care the way we do it.
Isn't there such an irony to the fact that everybody loves complaining about how busy we are? You know, it's like, oh man, there's no time for anything, and it's kind of I think it goes in a cycle where at first you want to get busy and then you're complaining about how busy you are. And then you learn how to prioritize and how to enjoy your free time and start to slow down.
Yeah, I will say two things to that. I always tell people it's ironic that you always say, I really wish I had a break. And then when you get a break, you really say, I really wish how busy I could be, because you're getting bored because nothing's happening. So, it's like when you go on vacation, you can't wait to get there. Then when you're there for so long, you're like, I really want to go back home. So it's just that thought process that it's always going to be this tug of war. The second thing I'll point out is that there's a good book that I'll plug called The Ruthless Elimination of Hurry. It's a book that someone introduced it to me. I'll say it that way. And when I came across it, no idea what to expect. But as I read it, it just was really interesting how the guy paints the picture on we constantly are going to think we need to be busy and busier is better, only to find out that we're basically hurrying to go nowhere, right? So the idea that I always remember from the book, he said, there was a point in time where people used to wash clothes using a washboard in a river. And that used to take forever to literally take your clothes down to the river, take out the washboard and wash your clothes. Then someone came up with the washing machine. And now washing clothes is way faster. But why is it you have still no time, right? Same thing with the dishwasher, same thing with the cell phone. Like there was a point where the things that we have used to be so slow and antiquated that we said when this happens, it's going to make us so much faster and we're going to have so much more time. But yet you get more fancier tools, AI, computers, cell phones, dishwashers, microwaves, all this stuff to help make you faster, more efficient, but yet you have less time. So why are we in such a hurry? It really comes down to you and processing what are you hurrying to get to. So if you can eliminate that hurry and really be, focused on the moment and what you're accomplishing, your life gets better.
That's awesome. I honestly think the best time for our practice was when we were forced to slow down surrounding COVID. Of course, there was a lot of suffering going on right there, but it forced us to slow down. I think a lot of people agree with that. And then now we're into the chaos.
Agreed. 100%.
I guess we'll just get started on some of the topics I want to dive in with you. So the main one is, what inspired you to open up the Byja Clinic?
I think the short version is, and it may sound kind of doom and gloom, but we've talked about it several times. The healthcare system is broken in America when it comes to getting people quality care in an efficient manner with a transparent cost. I'll say that again because sometimes people kind of get confused. It is broken because it's hard to get quality care in an efficient manner with transparent cost in America. If I'm wrong, somebody come tell me. But I've yet to find anybody say all three of those things can be done, and this is how in the traditional system. So the clinic we started was based on, I want to give people care, regardless if they have insurance or they don't. I want it to be affordable, and I want it to be a lot faster than what we are already doing in the insurance-based model. And from there, that idea spurred me to say, okay, well, if I can't do this within the model, I may need to do something different. And of course, I learned about direct primary care. And from there, I always had that interest in doing this model and doing this model and doing this model, but finally got enough courage to take the leap. In late 2019, And then at that point, went to a conference, saw all these doctors who are amazingly happy, which is unheard of whatsoever. Like seeing doctors smile and laugh and be happy about going back to work is usually the opposite. They're happy to be off work, but dreading going back. So when that happened, it kind of gave me the courage to say, I want to do this. I want to do what they're doing. And from there, I said, I'm going to start in 2020 and kind of kicked it off from there.
So what were you doing before you opened up the clinic?
Yeah, so I was a traditional, what we call fee for service doc, which means we're charging people every time we give them a service. So with fee for service, insurance is usually involved. Not always, but usually. So if a person comes to the clinic, we are going to charge them a fee. If they need us to give them an injection, we charge them a fee. If we need to have them come in to do some type of procedure, there's a fee. So I was that type of doctor in an insurance-based model at a residency program. So I actually was training doctors on how to be doctors. And from there, I just got to the point where I just really didn't like what we were doing. The pandemic was happening in early part of 2020 after I kind of felt like I was going to take the pivot to direct primary care. And whenever these people just got sicker and sicker, and we would just kept being told, see more people, see more people, see more people, yet nobody was getting better and we were getting burned out. Like to me, it was just a bad system, right? People were waiting in the waiting room for hours. We were basically exhausted and kept having to see people. We then had people going to the hospital left and right. People were dying. And we were just told, look, this is the way it is, just keep working. And it just makes you feel like a really bad person in my book, where you can't help people the way you want to, or you can help them, but you're told that you're taking too long to help people. Like it just doesn't make sense. So when that happened, it was time to go.
Yeah, it really feels like doctors, nurses, really everybody on the front line of healthcare kind of takes the beating for the way the system is structured. So I think we should start off, because a lot of people aren't exactly familiar what direct primary care is. And I think that's pretty critical to how you go about treating patients. So before we get into the treating of the patients, I'm like you to kind of explain direct primary care a little further.
Yeah, so direct primary care, or you'll hear us say DPC, is a membership-based model for medicine. A lot of other systems and industries are doing memberships or subscriptions. So gymnasiums and places people work out have been doing it for a very long time. Over the last 10 to 15, maybe 20 years, streaming services have popped up and started doing memberships. And that's the way a lot of industries are going. So it's no surprise that medicine is no different. It's just that a lot of people don't know it exists. So for us, we do a membership every single month, regardless if a person has insurance or not. They pay us directly in a membership model, and we give them care, just like you pay Netflix or Spotify to give you access to their services once a month. Then they provide you with that service, just like you pay the gym once a month to go and work out, and they give you access to the gym. People pay us once a month and we give them access to medical care. And that's just the basic premise of DPC. There's more in the service and the types of services you offer. Some doctors may offer, certain services, whereas other doctors may offer other services. But overall, the concept is it's a membership style. You're paying directly to the clinic, whether you have insurance or you don't, and they give you care. That's it. That's the simple and short version of it.
Yeah, no, I love hearing you talk about it, because I feel like you explain it in such a good way. A common thing I kind of hear is, how would you differentiate direct primary care from something like concierge medicine? Or you hear in Baton Rouge or a lot of the surrounding areas, you have the MD VIP and stuff like that. So I guess, what are the similarities? What are the differences?
Yeah, so very, very, very similar. Amazing question that we get all the time. Concierge does charge you a membership, but most concierge practices require you to have insurance. So not only are they charging you a membership, they are also billing your insurance every time you show up. So it's a gift and a curse, because while you do probably get higher end care by being a member, I tell people when they ask us, like, why would I be a member of your practice? I say, well, think about stuff like a Costco or a Sam's Club. When you're a member, you kind of get extra stuff that other non-members don't get. So in the concierge model, you probably get higher end services. The downside is if you lose your insurance, you probably lose the concierge doctor. So in essence, some people will say concierge practices double dip, because they're billing insurance and charging you a membership. For us, direct primary care, insurance is a bonus. If you have it, great. We'll use it outside of the practice, outside of the four walls of the clinic, but inside, and for things that we do and we control, we only want to have you pay us directly. Now, you may say, well, why? Think about car insurance and cars in terms of the car industry. When you go get gas, you don't take out your insurance card. when you go to get your oil changed or you go to wash your car, you don't say, I wonder if they're in my network. You just say, how much does it cost? You pay for the service and then you go on your merry way. By doing that, you're filing less claims with your insurance for car services. Imagine if you filed a claim every time you washed your car, rotated your tires, changed your oil, or filled up your gas tank. Your car insurance would be really expensive. In healthcare, the reason it's so expensive is because we use it for every little thing. We use it for copays, deductibles, premiums, x-rays, labs, medications, referrals, and that's just a few things. So if we're using it every single time for every little thing, the price goes up every time because we're filing claim after claim after claim after claim, so insurance gets expensive. In direct primary care, different from concierge, we don't file all these claims, so we tend to be on the lower end of cost, and we give the same service compared to a concierge doctor who gives really good service, but also has more than likely a higher membership and the requirement of insurance.
But you do help them use their insurance if they have it. Is that correct?
Correct. We absolutely prefer if you have insurance for big ticket items. So if there's an expensive medicine that we cannot get you through the clinic in a direct way, we then want to use your insurance. If you need a referral to a specialist and we need to have insurance for that referral, then we want you to use it there. If we need to do an MRI or a big procedure and we need to get something covered, that's when we use it. But we're limiting that for those big ticket items. Like I said, in car insurance, if you have a big crash and you need to get your car fixed, then you use your insurance. But for the small everyday things, you don't. And that usually makes your car services faster. Because again, imagine if you went to the car dealership to get your oil changed and they say, well, we got to vet all of these insurances to change all these oil pans and oil services. It would take you a long time to probably get your oil change. So now that they're just paying for your oil change directly, it's in and out, it's a lot faster. So that's what we're trying to mimic in this direct primary care model and even in direct specialty care models, because a lot of the specialists are starting to go to these types of models as well, where insurance is on the outside of the doctor-patient relationship, and we have it and we're ready to use it if absolutely necessary, but otherwise everything else flows between the patient and the doctor. And usually when we do that, everybody's a lot happier.
That tends to make things. Yeah, I heard about a couple clinics like surgical centers that are actually 100% cash in some states and things like that, which I think at the very least it helps create, as you said, that direct communication between the patient and the doctor. Because a lot of people like to know, hey, I want X, I'm willing to pay Y, and I want to know what I'm getting. And I think you said it best one time where you said that insurance companies are turning doctors' offices into collection agencies because
100%.
it's impossible to know. It's impossible for a patient to understand their own insurance. When you look at that website, it's confusing. And even as a healthcare provider, I go look at some of these insurances and we don't even know until we submit to insurance. And then the insurance then responds 2 months later. And all of a sudden you're having to send a bill or things like that. And then the patient might not have fully been aware, which is the worst thing from a customer service perspective, because you always want to have full transparency. So
Well, let me jump in because we can talk about this for a very long time,
yeah.
you and I, but more importantly, I think you hit two specific things. What other industry can you provide someone care, service, or a product? And 4, 5, 6 months later, they can literally change their mind and say, we want our money back. I mean, I really want you to think about it. What other industry can you go and literally say, I bought this car from this dealership, and 6 months later, the dealership can claw back your decision for what you decided to get done and paid, right? Well, look, we were going to we were going to accept the fact that you wanted to have these very nice 24-inch rims on your car. However, we decided that you really only need 18 inches. You would be like, what are you talking about? I already did it. I'm already driving the car. And that doesn't make sense. That's the whole point. And why am I saying that? In that analogy, that's if insurance is in between the transaction. Right now, you can't imagine what that would mean to buy a car from a dealership and the dealership has to take it back. Of course not, because why would they want to? They just sold you the product. But if the dealership had to depend on the insurance to get paid and the insurance could claw back their payment, and then they have to now come after you to get paid, and then if not, they repossess your car, you would be like, this is a horrible system. The problem is no one thinks about it in any other industry because that's not commonplace. In healthcare, it's commonplace all the time. And most doctors, most providers, most people on the healthcare side that deal with billing know the nightmares of that billing. A lot of patients know it too. The problem is other people don't think, what if there's a different way? So when we come in and show them there's a different way, most doctors, patients, providers, everybody is like, some people are just flat out, no, I don't want to do that. But a lot of people are like, this is really interesting. I think this is something that I'd like to know more about. How can I be a part of this? How can I do it? If you can figure it out, it's really better over here, right? I always joke when people in the direct primary care space are saying, I'm going to start my direct primary care practice. I usually say, well, welcome is much better over here as the first thing I say, because that's the truth. It's not where, you hear me say, oh man, today was a tough day when I only saw 4 people, right? Like compared to seeing 45. It really is better. And then whenever, and I'll use you for an example, if Dr. Chris comes and pays me for my work, more than likely Dr. Chris won't come back 6 months later and say, hey, that thing you did in January, I want my money back. Like it just doesn't happen. But insurance, it happens all the time. They can claw back their quote unquote reimbursement at any point, and you don't really have any recourse other than to give them more information and basically be at their behest. And at that point, that doesn't make sense to me. We really want to clarify that you working for your patient in the patient's best interest should be paid in full, and there shouldn't be any questions about it. And by doing that, patients feel better, you feel better, and the insurance is on the outside where it needs to be.
Yeah. No, that's an awesome way to put it. So I guess this transitions to me because I think we could talk about the difficulties or obstacles that insurance creates for 2 hours. But as we go, so with the Wellness Academy in Baton Rouge, one of our goals is to continue to foster collaboration and communication between different healthcare providers. And I think the primary care practitioner is central. Really, they're the quarterback of this of the patient's health. So with that being said, how do you feel like direct primary care, or just in general, your clinic, the way you practice, how do you feel like that helps you kind of fulfill that mission?
Yeah, I think for us, we are beyond just another clinic for Byja, the BYJA, because our mindset is to always make everybody who we come in contact with feel better, that when they hear my name, our clinic name, that they're like, oh, that clinic is awesome, right? It's just like when going to a certain restaurant has amazing food and customer service, you're not going to say, well, I don't want to go there. It's, I'm happy to go there. I'm happy to call and get a reservation. We kind of operate in the same way. And I think in really good primary care practices where the insurance is not muddying up the waters, you really can tell how good people feel going to that clinic, how good people feel sending people to that clinic. A lot of that takes a lot of work, a lot of effort. But if we can do it the right way, people just feel better, right? Like I have doctors who send people to me because they know they're going to get a really good evaluation, someone who really is going to listen, someone who's going to take time and be extremely thorough. I literally had a visit with a patient of mine. She's been with us for about 2 or 3 years. And I think I'm going to try to make it as simple as possible. She said, my parent and my sibling live in Alabama. We're in Louisiana. She's like, I really want them to come see you. I want you to let that sit for a second. This isn't, they live an hour away. They live 4 or 5 states away. And she's like, how can I get them to come to Louisiana to see you? And this wasn't being nice. This was, hey, I gave you doctors in Alabama, but you said that you still want them to come to see me. That tells me I'm doing something right. And that primary care mindset should be, we're primary. We want you to come through us, and we do such a good job that when we send you out of the door, we've exhausted every option, and this is the best thing for you. So if we can do that in primary care, not just at my clinic, but all primary care, healthcare gets better, it gets faster, it gets more affordable, because before we go and put you in the expensive body shop to do all this work, we just change that oil, and the oil cost and the labor to change the oil is so much cheaper than having an accident because the engine burned up. Like it makes sense to say, let's go ahead and spend more money on maintenance and prevention than big ticket items. So that's what we're mirroring in the idea. We want people to really feel comfortable coming to see us. We want people to feel extremely excited referring to us. And then from there, if we can be the standard of all primary care, then I'll take that challenge.
Yeah, it's funny that you did that because I had an entire question teed up for you to elaborate on your title, Beyond Just Another Clinic, and you teed it right in there, which was awesome. For people that don't know, his clinic is the Byja Clinic, BYJA, and Beyond Just Another Clinic, and you can actually see the logo in the back. So it's
Well,
It's very, very
but we
connected.
have to tell people the full story because I spoke at a men's conference over this weekend, and they were like, "Well, your clinic is beyond just another clinic, Byja Clinic." And I said, "Yeah, but the true story of why we came up, and Chris, you know this very well. I said I want something easy to say and easy to spell, and I want it to be something simple and quick, right?" So I was like, "Well, how many letters is easy? Somewhere between 4 to 6, most of the time, right?" So think about Nike, Google, Costco, things like that, right? So I was trying to find one word that could be something like that that no one else had. So I looked and I kept looking, couldn't find anything. Something just hit me and said, "Why don't you take your name and try to come up with something?" So I took the first 2 letters of my first name and the first 2 letters of my last name, and I just put them together. And I was like, that makes sense. It's easy to spell and it's easy to say. So that's where Bijah came from. Now, of course, people will butcher it and say all kind of stuff, but it is that basic, right? And the beyond just another came after me playing around with it. But literally, I'm like, we're going to be like Nike, right? Like we're going to be easy to say, easy to spell. No one else has this bad boy. And it is trademarked. I just want to say that. A lot of people don't know that it is trademarked. I need to update my logo and stuff like that. I'm waiting for my copyright approval. And once we approved, again, people won't be able to hopefully steal the Byja name and the Byja logo and the Byja idea because this is a movement, my friend. You know that.
Yeah, I actually never knew the full story that you actually just took your name. I think that's the funniest thing.
Hey,
Is that breaking news, or is that's probably been told
I
over a
feel like
couple
I
glasses?
feel like a lot of people know, but not as many. You might have some people that are really like, well, I want to start something, and now they're going to start thinking of different things they can do with their name. But more importantly, you don't have to always have the most basic whatever. I believe in doing stuff in your own way, and direct primary care, the name of our clinic, everything probably has my touch on it, but the touch is more so you want to feel good about what you're putting out into the world. And if I feel good that when you say our name, no one else is going to have that name, it's not like, first primary care on such and such street. Like, I'm pretty sure you go to enough streets, you might find a different one, but you're probably only going to find one Byja.
That's true. I think there's like 100 wellness academies, but just keep it rolling, you know. There's
There's
only
only one,
one
there's only
Wellness
one with,
Academy audio, and there's only one
well,
Wellness Academy Baton Rouge.
I was going to say there's also only one Wellness Academy featuring the Dr. Chris Riedel. That's all I'm saying. So at this point, I feel like we're on to something.
Yeah. So diving back into kind of how you practice. So you spend about an hour at least. I mean, you're on the phone with people, you're constantly managing them. But how do you feel like that helps you catch different things from a maintenance or a preventative care standpoint?
Yeah, I mean, I could give you story after story where just having more time has helped us fend off catastrophic things. Today alone, I was on the phone with a patient who unfortunately has been admitted to the psychiatric hospital several times in the last 30 days. From that psychiatric admission, has been put on medicine, is not feeling well. So I've been on the phone with this patient at least 6 times in the last week, talking about medication management, when to go to the hospital, when to get additional lab testing done, when do we need to make adjustments to the medications, if at all. And then today alone, before we hopped on today, I was on the phone saying, after all of the stuff that we talked about, this is when you go to the emergency room because all of the things we've talked about haven't worked. Now, imagine if we didn't have that, going to the emergency room and to the emergency room and to the, like, it could just get very tedious, missing work, not getting good information, not getting good answers. But by us having that relationship and the ability to talk, text, and email, and it doesn't cost anything, patients just feel better reaching out to us so we can help talk them off a ledge at some point, but also encourage them when to go in. And that amount of time is not something that people take lightly, especially me. I want them to know that we're going to take our time and solve your problem. And if I can't solve it, when we refer you, it's because we've went through any and everything. So that hour-long visit that we do every time we have a patient come to see us, it literally gets filled up to where people don't even realize it's been an hour. We've
Yeah.
talked about so many different things, personal, financial, emotional, you name it. We literally do that and they feel better because the point of going to any doctor, last I checked, was to feel better. So if we can make you feel better by giving you more time, more acknowledgement, more detailed, more thorough, like it just makes people feel better. And I feel better knowing that we gave them that much more.
Yeah. No, that's awesome. One of the things that I notice with you is you're one of the best at communicating, right? I can always find a way to get you on the phone if we want to talk about patients, or you're always grabbing me in between patients or something like that to get an update on someone you're about to see or things like that, which I think is It's really awesome because that goes to the complexity of the entire patient. And I noticed that in the sports world too. Like you have so much more success if you're able to communicate with the coach or communicate with the trainer, because it's just like, if you look at a team, they have someone who is handling every aspect of the situation. And I think each patient should really strive to have a healthcare team, like somebody who is really specialized in each thing. But you also need somebody overseeing that issue, because I find that a lot of times in healthcare, you also find patients are getting caught where they're seeing 1,000 different doctors who are all managing just one little case, but there's nobody kind of putting together the big picture.
Yeah.
I don't know if you
And I,
see that a lot.
but I think you checked the box that everybody hopefully listening, and if they're listening really closely, picked up on. It's collaboration. And, Wellness Academy, when you came to me and said, this is something I'm thinking about, other than me giving you a hard time about what's taking so long, I was like, this is completely fine. It makes perfect sense that you get a bunch of people together and get them on the same page. And if the focus is to get the patient to feel better, wouldn't you want a bunch of smart people on the same page? Like, to me, that's a no-brainer. The problem is in the traditional model, you don't have enough time to do that. So you having to see a lot of people and me having to see a lot of people, how can we get on the phone and take time? We can't. So at that point, it's disjointed, it's not efficient, and it's not transparent. So the care is not good, which we went back to in the very beginning of the show. So by having collaboration, all that literally just makes things easier where you don't repeat the same test that I just did, or I can get the information on all the stuff you think or the things you've ruled out so I don't go down the same road, and the patient gets better care that is more efficient and usually more transparent. So if we can do that in collaboration, primary care, specialty care, chiropractor, physical therapist, dentist, if we can do that, patients will get better. The problem is the system doesn't want us to do that. And it's not because, if you want to be conspiracy, it's not because somebody's sitting back and saying, well, we're going to keep them separate. It's that it's built to make you do volume. And by you churning out more bodies, more visits, more prescriptions, things don't really change. If we wanted to change, we got to change. And if we can change and get on the same page and collaborate, trust me, it's going to be much better.
Yeah, the system definitely makes practitioners who want to collaborate and do a lot of these things, it makes them go above and beyond. And there are countless practitioners within the insurance model, I like to think myself, where we're going to try and go above and beyond, but the system certainly makes it as difficult as possible, because a lot of the insurance companies continue to choke off. Really, they make it very difficult. I don't need to get into
Yeah.
that too much further.
Well, let me say this. You're technically still in the system, so you can't say it. Insurance companies are the worst. I'll say it for you. Okay. I literally talk to doctors offline in private conversations, and none of them are like, oh my God, my insurance company interaction was so amazing. Like nobody says that. It is the worst experience to get on the phone with an insurance fill in the blank, whether it's a third party administrator, pharmacy benefit manager, PPO, like all these letters that don't really mean anything other than drama. It really is the worst feeling. And it's not because I think the people who work there, I don't think they're doing it on purpose, right? But they don't realize that they're a part of the problem. I've literally told people on the phone flat out, get a new job. I was like, your job is the worst. You need to find a new job because you sound like a nice person. And I know you don't mean to be, hurting these patients. So if you really, are a good person, get a new job. Like I'm that blunt with people because again, I'm not beholden to the insurance. They're not going to give me any reimbursement. So I don't really care that much. But I say it in that way because we know that we know that to be true. Patients know that to be true. People hopefully listening to this episode know this to be true. They just don't know there's a different way. And then the alternative is whether going to a different system like I did, the alternative is to leave the system altogether, right? Dr. Chris Riedel is now Chef Riedel. And you're like, well, what happened? He's a great chiropractor. Well, he got burned out and he hated the system and he wasn't getting paid his worth. So now he's doing something like it makes no sense. The reason why that happens, they're going to churn out more chiropractors who are okay getting pennies. And then when they get tired, they churn out some more. So it's just a really bad system where the people who are sitting up and really understanding how it works, they're making hand over fist. You and I are miserable. The patients aren't getting any better, yet the system continues. So we got to do something else. And by doing what you're doing right now with this episode, this platform, and all of the collaboration, we can probably start to find a way to get better, not only with caring for patients, but get better with each other and get better with our business acumen.
But And absolutely. And I think a lot of it just comes down to incentives. The incentives of a system are going to result in results that are incentivized. But yeah, one of the big goals of this group is to try to get people who are busy together so we can talk, so we can collaborate. But that kind of transitions me into the next thing I want to talk to you about is how you've actually created a group within Byja where you're actually focusing on your nonprofit to help create affordable care while also creating a community within Byja. Do you mind telling us about your nonprofit and the community you're starting to create?
Yeah. So our idea was we do a membership, and sometimes people can't afford the membership because we want to still get value for the people who are delivering this amazing care. We don't want to lessen their worth because we tend to see people in healthcare think that the only way to give care to make it affordable is to give it away for free. And if you learn anything about business, if you give all your product away for free, you don't have a business. You have something that's going to be a charity, right? So we don't want to make our care charitable care by just giving it away. We want to find a way to make it affordable and give it away when necessary, but yet the people delivering it still get paid their worth. So how do you do that? Well, we got the idea that if we can't just lower our prices and race to the bottom, we can't give it away for free. Is there a way to find more affordable, equitable care delivery with some creativity? So we came up with the idea of starting a nonprofit arm next to our for-profit arm. So what I've told people is it's similar to a hospital foundation that supports the hospital, where the foundation may raise funds and do programming that allows that capital to come in and go into the hospital to buy more EKG machines and more equipment for the neonatal intensive care unit. So we kind of took that similar concept and started our nonprofit arm, which we started in 2023. And from there, we've been going pretty good with raising funds, doing different programs that when people can't afford a membership, somebody who may come in and pay a membership pays just a little bit more. And that fund goes into the nonprofit, and that funding will then pay for someone who can't afford the membership in full, or it'll help to subsidize the membership. So, if a person comes in and says, well, I can't pay 100%, but I can pay 50%. If the nonprofit has funding, they can take 50% from the nonprofit to cover the actual balance. So then the doctor still gets their full payment. The patient has less of a burden. And then the person who donated feels better about giving people a fair chance to get health care. And in that equation, no insurance has been used, no care has been delayed, and everybody feels better, right? The doctor got paid in full, the patient got good care, the membership was doing what it should do, and the nonprofit was able to deliver that care in an affordable way. And if you donated, you feel better because you potentially got a tax deduction, but you also help somebody. So it makes sense to do that. It's tricky to get it set up and kind of come up with this, crazy concept in my brain. But when it finally started working, I was like, oh, this is a no-brainer that we are doing something right. The issue is, of course, getting people to see and understand it. Why? Because when people come in, what do you think the first phone call we get?
Yeah.
What insurance do you take? It's not, where did you go to school? How do you plan on giving care to a group that can't afford it? Like, no one asked anything about anything other than insurance, even though it has absolutely nothing to do with their health care. Insurance is not healthcare. Insurance is insurance. That's like saying, well, what kind of house do you have? Well, it depends on if I got, Liberty Mutual. Like, what? That makes no sense. But for some reason, people think healthcare is insurance. So when we take them out of it altogether and everybody can win, I think it's a no-brainer to keep doing that.
Yeah, absolutely. Well, I think, to be honest, I think a lot of it is also just developing the transparency there with it. And of course, helping, it's always great to be able to give back to the community and things like that. But I've also found a lot of people just want transparency about what they're paying for. So I hear a lot of resistance of about I didn't get care until I got insurance. And then I even look at their insurance and it's a deductible where the insurance isn't paying the bill at all. So they waited, but it didn't actually really help them that they have insurance, but people don't even realize because they just think that the insurance is, they can't go to places without having insurance. But that leads to a massive issue where patients are skipping care. And so providing that option for the community is incredibly helpful because by getting them to get care when they need it helps prevent higher costs later down the line.
Correct.
Is a
And
big thing.
I'll jump in and say one little other part that you kind of hit on that I think people can agree on and possibly acknowledge. The reason why people tend not to get care when they don't have insurance is because it's extremely expensive. And that's because
Yeah.
people who are providing care to uninsured are charging the same price often as they would charge to people who are insured. And that's backwards. It's the insurance cost is marked up to cover more people. So we're going to turn around and charge people with no insurance the same price. Like, so people just know it's expensive and they don't know why. So they just say, well, I'm going to avoid this until I absolutely need it, right? I'm going to avoid going to the mechanic until my car breaks down, is how people who don't often have really good means to cover preventative maintenance, they'll do that. So when we come in and say it's actually cheaper to not use your insurance, people are blown away by how cheap it is, that their prescription that we can provide to them directly in the clinic may be $2. But if you go to the pharmacy, that $2 cost is for 90 days. At the pharmacy, a 30-day supply is $4. So when you're doing math, you're like, it's, 20, 30, 40, 50, 60% less to just pay for it up front. And we're like, yeah, because you don't have to pay 17 people in the transaction. You just pay one person, your price is down. People are like, yeah, that does make more sense. It's just getting them to unplug from that proverbial thought process that insurance is good, without insurance is bad, and healthcare is expensive. Once we erase all of that thinking and start and reprogram, people are very cost conscious to say to us, well, how much does it cost? And then we'll make a decision, rather than, well, I don't know how much it costs, but I know it's expensive.
Yeah. So the alliance that you're talking about, that nonprofit, is called the Byja Charitable Alliance, correct?
Correct. Byja Charitable Alliance. We are online. If someone wants to generously give a donation, it is tax deductible. Again, we're not asking you to do much, but if you really take a moment to read into that donation page, it tells you that, your $10 may cover someone's medication for 6 months. It's really that cost effective when you think about it like that. But people kind of think about it from a sense of, well, what I'm paying is going to only do this. So I'm only going to, you just got to erase all that. But by doing that and getting in and becoming a monthly donor, you really are truthfully changing people's lives. And I don't mean in a what's the word I'm looking for? In a figurative sense, right? I'm not being figurative when I say that. I mean, literally, I've had people say, what do you mean my medicine's free for 6 months? And I'm like, yeah, someone paid for it. And they just start breaking down in tears because no one's ever done that, right? Because well, I paid for 6 months. How much was it? It was $22. Like, you're like, wait, what? $22 covers 6 months of medicine? Yeah, it really does, because we know how the numbers work. So if someone literally gives $10 a month and you're covering someone's meds for their whole year, you're changing lives, right? And that's what we really want people to understand this model does.
That's amazing. I think that's one of the coolest things. But you also have another cool nonprofit called the Comprehensive Medical Mentoring Program. Is that correct?
Yeah,
Would you like
that's
to tell me more about
CMMP.
that?
A short version for CMMP, it's a nonprofit that we started way back around 2017. And that nonprofit is focused on getting more minority students into the medical field. We often have a lot of people who are young minority candidates that are interested in going into medicine, but there are so many obstacles that they run into that they never finish. They'll start out in undergrad wanting to be a pre-med major, and then test taking, the cost of testing and getting the tests completed or getting the study materials done, having a mentor, being able to get transportation, all these things come up for these minority candidates that often their counterparts don't have to deal with. So what they end up doing is stopping, right? Look, well, I can't go to medical school because I can't afford it. I don't have enough money to fill out applications. I only can fill out one application. If I don't get into that one place, I'm not going to keep going. So we try to level the playing field by giving them free access to tutoring, mentoring, MCAT prep, shadowing, all of that, and they don't pay anything. Our goal is to literally raise funds so these students will not say, I didn't do it because I didn't have the means. If they change their mind and want to do something else, then that's fine. But a lot of us doctors who went through the challenges with no help, we know what it felt like. And I went through it and I was like, I don't want anybody to ever have to deal with that. So we try to level that playing field. Again, we've been doing it for almost 10 years now. It started out as a program, roughly an 8-week crash course on how to become a doctor, and it grew from there to become a nonprofit. So that's where the program part came from. But it's now in Washington, D.C. and Southern Louisiana for the most part, but we have students all across the globe. And I mean that, where like other countries actually reach out to us to talk about how to get into medical school. So it's pretty cool, man. It's very rewarding.
Yeah, that's awesome. Getting to help train them. the next generation of young doctors too, and different healthcare practitioners. It doesn't have to be med school. I know you've talked to me a little bit about helping mentor people on pre-physical therapy. And also I think it's just a confusing time for a lot of college grads, like figuring out all of these different fields that you can go into. And a lot of students kind of aren't aware of all the different options. There's a ton of different healthcare professions out there that you guys educate on and have mentors for, which is really
Yeah.
cool.
And our team at CMMP, I think, is really cool because they're not all physicians, right? We got quite a few physicians, but we have pharmacists, we have physical therapists, we've had people who are not in the medical field at all because a lot of times students just need mentoring, right? And I'll give you an example. If Dr. Chris has a student who's looking for a way to get a scholarship, and Dr. Chris happens to know 5 scholarships, and the student now has saved money and doesn't have to get a job, you helped them. It had nothing to do with you being a medical professional per se. It's just I know how to get a scholarship and I know how to fill out an application. So that's all it takes. We just need some people who want to help, and from there, things will change.
Well, and even basic things. I've known a couple of your mentees, and I know that you work with finances, which understanding finances is one of the most important things. Finances, creating your resume, writing an essay. As time goes on, a lot of people might not have the same education pertaining to certain skill sets or all of these things that make a difference for getting into med school or to other different grad schools. So think it's really awesome.
Yeah. And I think it's going to continue for the idea of getting students not only to buy into this. When we do a good job, those students end up becoming the doctor. So guess what they end up wanting to do? Come back and help the next generation because they knew what it felt like to have a helping hand. And we've had a couple of doctors, and I say couple of doctors, who started out with us as undergrads. And this is a very slow process. So imagine, again, we're almost 10 years in. So our first students may have come around 2015. And now, 8 years later, right? I'm not great at math. That's probably 2023, now doctor, right? Like, so it is really cool to see a student who started out with no one in my family is a doctor and I'm the first one. And I want to thank y'all for helping me do that. It's just a really rewarding feeling. And to see them now come back and serve within our organization to help the next generation, it just goes to show you're doing something right when you see that happen.
That's amazing. So kind of moving on, what would you say are some of the most common misconceptions that you experience as a primary care practitioner?
I think the most common is that if you are in medicine, you take insurance. Like that's the first thing. That might sound really basic, but the first thought is, I want to make an appointment. That's the first count. I usually say, well, how did you hear about us? Oh, I looked on your website. Okay, well, do you know what direct primary care is? No, I have no idea. This is a membership-based model, and whether you have insurance or you don't, you pay us. So y'all don't take insurance. Like that's the first question. So it's almost baked in that if I don't tell them we don't take insurance, they automatically assume we do. The second, I think, big misconception we hear in primary care is that when you deliver primary care, you have to do it in a very specific way where it's in this kind of cookie cutter approach. You're going to fill pills or medications because that's how you treat most disease. You're going to do a ton of referrals because that's how you get most people the best care. And you're going to potentially order a bunch of tests and images because that's how you get the result. When we do it, we don't do half of that because a lot of the time it just means we just have to ask better questions and take more time. And by doing that, if I can change your diet, if I can get you to start moving and exercising, you don't need all that medicine. You don't need all those referrals. You don't need all those tests. You feel better and you save money. So those are probably the two biggest. You take insurance, so somehow you're going to give better care. And then once you get into care, it's a lot of prescriptions, a lot of referrals, a lot of tests that are ordered. Whereas when you really do a good job, most of those things are not true at all.
Yeah. So all of a sudden you're talking about, referring to a nutritionist or registered dietitian. You're kind of treating the entire patient, which is awesome.
Well, I'm gonna take it beyond that. Think about it from how about I refer you to a therapist because you think that the stress level you're having is normal. And the reason why your blood pressure is so high is because you're so stressed and you're in such a toxic environment, it's making you physically ill. So if I can get you to start seeing that, I didn't prescribe any medicine, but I got you to talk to someone that really helps you to see the effects that your mental health is playing on your physical health, that literally makes a difference. And that's why I said we talk about that. And I take it one more step. What if I get into a visit and I make you realize that because your finances are so bad, it's affecting your work-life balance. So now you're working two jobs, which is literally running you into the ground. So now you're physically sick because your finances are a mess. So what if we get you with a financial planner who potentially can do it in an affordable way through our nonprofit? And by doing it through our nonprofit, you're not going to break the bank. You're financially going to get better. You're taking care of your family. So now the generations after you won't be in a hole. And now you're going to feel like it really just feels better. Like people are like, I never even thought of these layers. And it's because most doctors are like, I got 10 minutes. I ain't got time to talk to you about your finances. What's your credit score? What? That's not even in our purview. I don't talk about credit. And I'm in here saying, yeah, let's talk about your credit score. How do we make it better? And they're like, no one's ever talked to me about this, but I really do feel better now that I know how to get my finances together. I had a guy reach out to me today. He said, I'm feeling really stressed about my relationship with my wife and my four kids, and I don't know if it's something or other. And long story short of that, I told him, I said, we need to get you in to talk about this. He's like, well, I'll come in at the end of next month. I said, you'll come in next week because we don't need to have you lingering on this for 4 weeks and think it's magically going to get better. It's being very proactive. And his thought was, well, it doesn't cost me anything because I already paid for the month. I'll see you next week, right? It's faster and it costs nothing other than one price per month. And we're not writing any prescriptions. We're just taking time and being good people and good doctors, and people just love it.
That's amazing. Definitely a different level. And I appreciate that, you're obviously going to be BNI president or something with that reference to how outside the box you're thinking about connecting different people. Little BNI reference there for for everybody. So what do you say, like looking ahead, what do you see as the biggest opportunity for collaboration among different healthcare fields? And how do you feel like this will help improve outcomes?
I think it's a seamless transition from getting patients to not only feel better, but for you to have an easier job. If I can call you early at the first sign of a person having really bad shoulder pain and you see them in a week rather than you see them in 6 months, your job is probably going to be easier and my job is going to be easier. So I think collaboration not only makes it easier for us to care for patients, it literally just makes us overall faster, more efficient, and the care to be more affordable. So I think that collaboration not only helps patients, but it helps us because when I get to talk to another smart person who knows what I'm talking about, I don't feel like I'm now having to basically talk to a third person on the phone at an insurance company and explain to them what an MRI is because they're like, well, that's not on the paper. They don't need an MRI. It's like, yes, they do. But if I have a person next to me that says, yes, three of us all agree they need an MRI, you feel better as a professional, right? So that collaboration professionally makes you really like your job because you got people you can call and they'll have your back. Hey, Dr. Chris, I got this lady. I really need to get her seen. Send her over. I'll take care of it. Like you just automatically say, that was way better than, well, let me get on the internet and see who takes her insurance and hopefully we can get them to answer the phone and all that stuff. So it helps patients, it helps us professionally, and it keeps us in the game a lot longer.
So I guess a final question for you is, what is the single most important lesson you've learned from your journey that you would like to share with our audience?
I'll give you two and I'll make it quick because I can talk a lot. So the first thing I would say is don't feel like you're ever fully finished if you fail. You can always get back up and start again. Course correction is a part of life. And if you can do that, you're going to be fine. Most people kind of get really nervous about failing, so they never really start, or they fail and they give up. And then they feel like that's the end. But if you would have just kept going, it would have been so much better. We could talk about that for a long time, but I'll leave that there. The second thing, and you will appreciate this, is three simple words. Just press send.
Just press send.
Just press send. And that's our inside joke for anybody listening, that Dr. Chris and myself, he'll have an idea and I'm listening to him and I'm telling him how amazing the idea is. And he's telling me after weeks, if not days or months, of all the plans. And I'm like, just press send, just start. And this is a testament to that. This very first episode of Wellness Academy came from him talking to me saying he wanted to do it. And I said, whatever you need, I don't mind helping. But that ability to get over the analysis paralysis is the second biggest part. So if you're not afraid to fail, because even if you fail, you're going to keep going, one. And then once you know that, just get started. And once you get started, you can course correct along the way. And at that point, you'll be fine. The problem is those two things usually cripple everybody. I have doctors, med students, whatever, and they're afraid to start because they're worried about what's going to go wrong. And from that, if they can eliminate that fear of getting started will go away. If you talked about my full story of getting to where I am now, you would hear me tell you that I failed more than most people in life, but I'm still here because my mindset has always been, this is not the end. You got to drag me away from this in order for me to be considered a failure. So if they can do that, get over the fear of failure, don't feel like they ever can't course correct, and get rid of the analysis paralysis, we'll have a lot more people doing really great things like yourself with this first episode, man. Congratulations.
Thank you. Thank you. Thanks for being here. Two real quick final things. Do you mind telling everybody about your book, also your podcast? Just let people know where they can find you.
Absolutely. So the name of our book is the Byja Blueprint. The Byja Blueprint is an introductory guide to direct primary care for doctors, patients, and businesses. It can be found on pretty much all regular platforms, things like Amazon, Barnes and Noble, Apple eBooks, things of that. We're working on the audiobook version, so hopefully that'll be out soon. So definitely get that if you're interested in learning more about how direct primary care works. It's a very high level introductory guide. It's not going into the weeds. It just tells you from a concept standpoint how it works. And most people really think it's an easy read, which I'm happy about. And the second thing is the Byja radio show. As I tell Dr. Chris all the time, it's not a podcast. It's a radio show, which is probably one of the things a lot of people come up to us and say, which I think is cool. We are on in season 3, and we are going to be starting season 4 later this year. It's myself and our very first patient of Byja Clinic. He likes to call himself Patient Zero, which is weird, but somehow it's catchy. Brother George Becknell is our co-host, and he's awesome. So we are loving the fruits of that labor of love. And I literally got a message today from a pharmacist who said, as a pharmacist, I really enjoy y'all's show. So again, we're doing stuff that is not conventional, whether it's a book, it's a podcast, it's a nonprofit. We just started. It wasn't perfect. If you go back and listen to the first episode to the last one that we put out, you can tell the progress that's been made. But I say that to say, I'm not saying anything on today's episode based on it just magically worked. It came from work. It came from continuing and persevering and pushing forward. And, you're going to get there. You're going to have your breakthrough. You just got to keep going.
Yeah. The podcast is the radio show.
The radio show. Thank you, sir. Thank you, sir.
My apologies. The radio show is amazing for anyone that hasn't got to check, because you have breakdown episode by episode with educational information about different conditions, from thyroid to men's health to diabetes to just you guys discussing insurance or the healthcare model. So George adds some amazing comedic relief.
He is color commentary. If you're a sports person, I'm the analyst, and the color commentator is George Becknell, if that makes sense.
Yeah.
I set him up and he knocks it down. So it is a very good, entertaining combo. But yes, we try to make it educational, but also fun. So hopefully people enjoy it.
Well, excellent. And the final question is, who you got this weekend? You ready for football season? LSU versus Clemson.
I'm a Louisiana guy through and through, man. So I'm always going to go LSU. And I think the real Death Valley is always going to be in Baton Rouge. I will say it should be a good game, only because first game of the season, LSU historically in the last couple of years hasn't done well. So my hope is that this is the year we change it, but I'm going to always say LSU if that's the question, man. I'm a root for the home team. That's just how I am.
Absolutely. Absolutely. Well, very cool. Well, thank you, Dr. Jasper, for joining us today. It was an absolute pleasure.
Yeah, man. Thank you for having me, and best of luck on all things, and can't wait to come back as you continue to grow.
Awesome, man. Thanks.